Cry It Out Loud, a podcast by Chasing the Rainbows with your host, Bernice Quisenberry.
Pregnancy changes your body, but pregnancy after loss changes everything. It changes how you experience your body, how you listen to it, question it, and sometimes struggle to trust it again. So many parents, the body that once felt strong and capable can feel unfamiliar after loss, carrying not just physical challenges, but grief, trauma, and fear. And while so much of the conversation focuses on emotional healing, pregnancy and loss can also just have profound impact on pelvic health, core function, and the physical foundation of the body. So what does it look like to come back into your body after loss, to prepare for pregnancy again, for birth, for healing? Today, we're joined by Gina Conley, a birth doula, pre and postnatal trainer, and author of Training for Two, also a mother of four, and she has also experienced 2 early-term baby losses. Gina specializes in pelvic mechanics, birth education, and helping women reconnect with their bodies through pregnancy, postpartum, and beyond. Her work focuses on supporting women not just physically, but holistically, understanding how movement, strength, and body awareness play a role in both healing and preparing for birth, especially after loss. Gina, thank you for being here and for helping us have this deeper conversation about what it really means to come back into your body after loss.
Thank you for having me.
Yes, and I would love for you to share with our listeners, your own personal story, who you are, and everything.
So my name is Gina. I'm the founder of Mama Stay Fit, which specializes in pre and postnatal fitness training and childbirth education. And I started my business after my first baby was born about 9 years ago now. It's pretty wild how long we've been doing this. I started primarily in person, and now we've expanded to a pretty large online platform with tons of free education options in addition to paid options and fitness programs. And I now have 4 babies of my own. But between my first and second, I did have 2 pregnancy losses back to back that were both like within the first trimester, but very different from one another, but still very challenging and really impacted my subsequent births. And each pregnancy from those losses was a little bit different as well. And so I would love to share my own stories with pregnancy loss in addition to kind of how I navigated afterwards, because I have found that the pregnancy after loss is really, really challenging, and it's a very unique way. And so, yeah, I could dive into that if that works.
Yes, please.
So after my first was born, I wanted my kids to be close in age. And so when my daughter was about a year old, my husband and I started trying to conceive. I hadn't like quite gotten my period back yet, so it was kind of like a hope to catch like the first egg kind of thing. Maybe I'll never have a period again. And it didn't really work out right away. It took us a few months, and then we were pregnant, and I was like, this is awesome. Like, our babies are going to be like pretty close in age. My sister was also pregnant, and so we were going to like be in this together, and we were like super excited about it. I was like telling everybody that I was pregnant. I've never been like a secret keeper with my pregnancies, and I'm really glad that I told a lot of people in hindsight. Around like 8 or 9 weeks of my pregnancy, I just felt kind of like uneasy, like just something. I just needed confirmation that everything was going well. But I just felt like oddly like anxious. And so I went to my provider and I was like, I would like to have an ultrasound done, or I would just like to check on the baby, and they couldn't find anything. So it was just like this black sac. And they were like, well, this ultrasound isn't that good. Come to the clinic, because I was at labor and delivery with my sister works there, and it was also the hospital and the clinic that I saw for my prenatal care. And so they were like, the ultrasound here on labor and delivery is like not that good. Like, go to the one in the clinic and we'll definitely see the baby. So I went to the one in the clinic, and same thing, couldn't really see anything, but they could see like this like yolk sac, which was like a pretty big indicator that it had a miscarriage, which means that at some point this baby was not developing anymore, but my body had not like recognized it. And so they were like, well, maybe you're just like really early. And I'm like, I could be like a week or 2 off, but I'm not like a month off like that. Like, so fortunately my provider was like really patient with me, and we did ultrasound after ultrasound for about 2 more weeks. And by like the second week, I think like we had all accepted that this was not a viable pregnancy. I was like browsing forums about miscarriage. People were saying like, oh, I went in for my D&C and we did an ultrasound and they found the baby. And so I had kind of like convinced myself that this provider is really bad at ultrasounds. The baby's just hiding. But I wanted to give myself some time. And it gave me about 2 weeks to kind of process that this was not happening. So we decided to do the medication that you take at home. And when I didn't really know what to expect when it came to the loss. And I had never heard anybody else talk about this before. And so I apologize to any listeners that maybe are not prepared to like hear this conversation or maybe brings up something for themselves. But I feel it's like important to share because I didn't know what I was supposed to be looking for. So my pregnancy, I was maybe at like 11 or 12 weeks at this point. Granted, it wasn't an 11 or 12-week old baby.
Yeah.
And so we took the medication at home. They also gave me some pain like medication that I could take to kind of decrease any discomfort that I was feeling. And I was just kind of like unsure what I was supposed to be feeling. I felt some cramping, had some bleeding. And then when I went to the toilet, I passed some tissue, but I didn't really know. I thought there was going to be a lot more tissue. And so I just flushed it down the toilet. And then in hindsight, I realized that that was the baby. And so I was like really sad that I had just flushed it and wish I had like pulled it out of the toilet and did so like buried it or something.
Yes.
But I didn't know what I was supposed to be experiencing because when I had given birth previously, there was a lot of clots. There was like just like tissue still kind of coming out for a period of time. So I just thought it was gonna be like that.
Yeah.
It wasn't. It was bleeding. It was I would guess like the same type of bleeding as like a period for me. But then there was this like mass that I thought there was gonna be more of, and there wasn't. And so had I known, I would have done something different with that
Yeah.
tissue. And so I'd like to share that because I would hate for somebody to like recognize that after the fact as well. Now, if you still want to flush it, that's fine, but just know that that was it. That was it.
Yeah. Yeah.
So after that, because I had a miscarriage, the provider wanted to do like, like weekly blood work with me to make sure that it wasn't a molar pregnancy. Which I'm not like super savvy on all like the different terms, but essentially it's like a potential like precancerous type of pregnancy, which is not good. And because it was a miscarriage, the likelihood of it being that is like slightly higher. And so they wanted my HCG levels to go all the way down to confirm that this wasn't a molar pregnancy. My husband, though, was getting ready to deploy and he was going to be gone for a period of time. And I wanted my kids close in age. So I was like, you know what? I'm sure it's fine. We're going to try. We've got like a month to see if we can do this before you leave. Let's give it a go. And it didn't work out. We didn't conceive. My ACG levels went all the way down. And then I just spent the next 6 months kind of dealing with being not pregnant in a way that I thought I was. A bunch of my friends were pregnant at the same time. They all had their babies. My sister had her baby. And then my husband came home and it was I never felt like angry at anybody else. I know that sometimes can be a common feeling. Like I think if anything, I just felt like sad for myself, where I was like, this was an experience that I was preparing for that I am not getting to do, and it kind of sucks. But I was never like angry at my sister or any of my friends for having their babies. I was still really excited to be there to support them as a doula. I never felt like anger towards any of my doula clients that I was still supporting. But I just wanted the experience for myself too.
Yeah.
And it kind of sucked to like be surrounded by this. And I had friends who had multiple losses kind of in the same time frame that ended up needing to like remove themselves from birth. Like they're like, I can't, like this is too much. And so I do think that there are different kind of thresholds for different people. For me at this point, I was like, it's okay. It's fine. I would think I was kind of still in denial as well. So my husband came back and we tried to conceive again. And after a few months, we conceived. And I again told everybody, I was like, we're pregnant. We're good. We've moved on from that fluke thing that happened. Nobody has more than one miscarriage. And then I went in for blood work. They confirmed pregnancy with my blood work. And then like 2 days later, I started bleeding. And I was like, oh, this doesn't seem normal. So I rushed to the ER because I didn't really know what to do. and I essentially told like the triage nurse that I was having a miscarriage, and she was like, well, don't count yourself out. Sometimes you can have bleeding. It'll be fine. And I was like, I appreciate you trying to be hopeful. And the ER doctor was terrible. He came in and we had been in the ER for several hours. He came in and he's like, well, you were pregnant on Friday and today you're not. So what are you here for? And I'm like, I guess a miscarriage. Like, what? like, can we read the room a little? So he was like, well, I don't think I have to do a pelvic exam. So I'll just kind of like do abdominal palpations. And at this point, I start like crying because I don't really know what else to do. In hindsight, I look back and I'm like, all of the things I could have said to this guy to like put him in his place. But I was just like in such shock.
Right. Of course you are.
So I'm sitting there crying and he's like, it's okay. My daughter had like a bunch of miscarriages and she got like 4 kids. And I am just still like, what? like it's not a competition. Like somebody
Exactly.
else having this like terrible experience also doesn't make me feel any better right now.
Right.
So it was not a good time. And after that, I went back to my primary care provider, and I had always been told that you have to wait for 3 losses to kind of do a workup. And at this point, I had 2 in a row, and I'm like, well, this does not seem very normal to me. And so I was really lucky that my provider was like, hey, and like she sat down and like got on my level and she's like, this is not normal. Like people are not supposed to have more than 1 miscarriage in a row. And I want to do a full workup on you. Like we're going to do a bunch of blood work. We're going to start getting everything that we need prepped so that if at the end of this cycle, if you have another loss, we can send you straight to fertility. Because we have it like within the hospital.
Yeah.
And I was like, oh, yeah, I would like to do all of the things. Like I still want to expand my family. Yeah, let's do it. And so we did blood work and we found that my thyroid antibody levels were really elevated, which could or could not be associated with recurrent miscarriage. And so I started some thyroid medication. I did the autoimmune paleo diet to get my levels down, and I like 1 month on that diet was like phenomenal. I got my antibody levels like super low back to where it was supposed to be. And we conceived our son during that cycle. And after that, I was like, at the beginning of my pregnancy to my husband, I was like, if we have another loss, I don't know if I can keep doing this. Like 3 in a row, I think it's going to just be mentally too much because I am mentally unwell with like, I am
Yes.
anxious every day. I am checking every single tissue that I wipe with whenever I use the restroom. I wake up every day wondering if this is the day that I lose the baby, and I have got like 9 months to go. Like this is a long time to be super anxious.
Yes.
And I spent a really long time in that pregnancy really anxious. My provider in the beginning did blood work like every few days just to confirm that the pregnancy was progressing. Once that we can see a baby, we were doing like weekly ultrasounds. And that was like really reassuring for me, and something that for my friends that have had losses and they're navigating a pregnancy, I was like, hey, I found it really helpful just to see that my baby was existing still, like either through blood work or through ultrasounds, like because I didn't have any signs that there was something wrong with my first pregnancy. Like I had all the symptoms, but I wasn't pregnant. My second one, it just kind of happened pretty spontaneously. And so I was really anxious every time I went to the bathroom. And so I was like, just seeing the baby with ultrasound just was super helpful for me. And so I've had a few friends that have also had losses and they have done that. And they found it to be super, super helpful for them mentally. Once I can kind of like feel my baby moving, I was much more reassured at that point. Like, okay, I could feel them. Like they're there, they're still moving inside. And I stopped doing the ultrasounds quite as frequently once I could see the baby. And so once I was in my second trimester with my son, the OB provider was like, hey, I feel like you're no longer like a high risk pregnancy. If you feel comfortable, like we can move you to like a midwife like care, because we had both within the clinic. And you can like, I would consider you like a low risk pregnancy now. And at that point I was like, you know what, I think I do feel comfortable. And I shifted my care to the midwives. But I still stayed pretty anxious that whole pregnancy. I didn't like buy anything for my son. I felt like really detached from the pregnancy. And it wasn't until I was nearing my third trimester when I had connected with somebody on Instagram who had 2 pregnancy losses later in pregnancy. So I think she was in her second or almost like third trimester when she had her losses. And something that she told me was that she had never regretted bonding with her babies, even though she lost them. And I was like, oh, that's pretty profound. I think I'm aligned with that. And after that, I was like, it's gonna suck either way. Like it's gonna suck if I completely detach myself and I lose this pregnancy, or if I'm completely like and deeply in love and bonded with this baby, it's gonna suck either way. And
Yeah.
I would rather know that during this pregnancy, I had given this baby as much love as I could. And so I went to the store and I bought him like a little onesie. I don't remember what onesie it was, but I went and bought him some stuff.
Oh,
And then COVID happened. And so now I was like, oh my God, now I'm really anxious about like what's happening in the world. And so that whole pregnancy was filled with so much anxiety. We ended up having a home birth. Things went beautifully. It was a perfect birth and labor for me.
good.
Um, but I stayed really anxious postpartum, and I dealt with a lot of postpartum anxiety and postpartum OCD. And of all of my pregnancies or all of my postpartums, that was the hardest postpartum for me, like mentally. And so I sought therapy, and that was super helpful for me. And then over time, I just started to feel more confident with
Yeah.
being pregnant and being postpartum and knowing that my babies were going to be okay. Because I just spent so much time so anxious during pregnancy that it just carried over into postpartum for me.
Yeah.
My next two pregnancies, though, I felt much better mentally.
Mm.
I was still anxious. Definitely wasn't like my first pregnancy where it was just like bliss and ignorance and everything. Those things happen to other people. They don't happen to me, but they did happen to me. They happened to me twice in a row. And so I still got the early ultrasounds so I could see the baby every week until I can feel them, because that was like really helpful for me, like anxiety wise. But overall in the pregnancy, I just felt at more peace because I think I had a successful pregnancy. Like I gave birth to a live baby and my son is thriving. And so I just felt a little bit more confident with my third baby. And I was like, okay, like still anxious, but like
Yeah.
I feel good. Like I feel like I can take the steps to set the conditions in my favor. I'm doing the things that can make me feel more confident in this pregnancy. And that postpartum, I felt much better. And then with my fourth baby, it was the same thing, like same ultrasounds in the beginning of the pregnancy. But I had two successful pregnancies at this point, and so now I felt a little bit more confident in it. But I also was like, I almost like surrendered to it a little bit more. Where I'm like, I would really love for this baby to be born. If they are not born in the way that I want them to be, I'm gonna surrender to
Yeah.
all the things that can happen. And that whole kind of pregnancy and labor was just a lot about like letting go of my expectations and just kind of like letting things kind of unfold the way that they want to, which took a lot of pressure off of me. And then this postpartum was fantastic as well. But that first one after two losses in a row was really hard. It was really, really hard. And for those that are maybe navigating that first pregnancy after loss, especially if it was after multiple losses, I think it's probably pretty normal to be like not unwell mentally.
Yes.
It's hard to go from if you've had a successful pregnancy before
Yeah.
to having no issues with that pregnancy and suddenly having a lot of problems. Or if you haven't had a baby yet, it's a confidence killer. Like you're
It
like,
is. Yes.
oh geez, like if there's anything that we've been told is like this is my like one big role in life is to produce children. Obviously we have other roles as well, but
Yes.
like
But
it's like this is the one biological function that I'm supposed to do and I can't even do that. Like it's really it's a confidence killer.
yes.
And so I completely sympathize with folks that are struggling through that. And then when you do get pregnant, it is really hard
Yeah.
mentally. And it's a long, it feels like forever. It
It
feels
does.
like the longest pregnancy ever. And for me, I had a lot of like postpartum, like mental health stuff that I needed to work through because I just spent so much time so anxious,
Yes.
but it
Yes.
does get better. For me at least, I found that every pregnancy from the losses, I just felt a little bit more confident in how
Yeah.
I was moving my body, how I was feeling in my mind, like the way that I was just navigating the pregnancy and the birth and the postpartum just felt easier compared
Yeah.
to that first one, but it was still kind of like lingering there
Yes.
for me. So those are kind of my stories. I like sharing my stories because after my first loss, because I had told everybody that I was pregnant, I also had to tell everybody that I was not pregnant. And in that process, I found that a lot of my friends had pregnancy losses that never told anybody. And they just kind of like felt like there something was wrong, and with them, like there was a lot of stigma with it, and so they just kind of like never mentioned it and just quietly like moved on and grieved on their own. And I would have felt really sad knowing that both the babies that I lost were never known. And
Right.
so like there was a period of time where I had a lot of people celebrating these babies. It was a shorter period of time that I hoped for, but there was still some time where there was a bunch of people super excited and people
Yeah.
that were celebrating with me. And then unfortunately, I also had a large group of people that were mourning with me and that were grieving with me, that were checking on me. And so I had accidentally created this like community for myself, which was super helpful, especially because my husband deployed pretty
Right.
shortly after the first
Yes.
loss. So
Yeah.
I had like a very large community of people that were wanting to like support me through it. And so every pregnancy after that, I had told everybody like as soon as possible, because I'm like, if you're gonna celebrate with me, you're also gonna mourn with me,
Yeah.
and that was something that was surprisingly really helpful for me. But totally understand if not everybody wants to do the mourning with other people as well.
Yeah.
It doesn't have to, you don't have to do like a large Instagram post or anything, but I did find it for me, like comforting to know there was a period of time that there was a bunch of people celebrating this baby and excited for this baby, even if we also grieved that baby. But yeah, so those are my stories.
Oh, thank you, Gina. And yeah, just to circle back on a couple things, I resonated so much with your story. I've, had pregnancy after losses, and I felt the same thing, that first one after having reoccurring loss. It's like, oh my goodness, and going to the bathroom, always checking, always looking like, and feeling like, what is something going to go wrong? Like, do I even know my body? Because that body shame, blame, and guilt that we have after loss is a stigma that we really do need to break in America. Because this isn't our fault. Like, we don't know what's happening, what's going on with it, with our babies and things like that to cause these things. Like, we don't get enough answers, right? But with you saying, and I cannot harp it enough. I know this is a trigger warning, but right, the tissue, right, your baby when you're at home and you're passing your baby, that was something that I regretted too. Was like not collecting in the toilet, right, and not knowing that was it. And because you can do things, make jewelry, get different things, bury whatever you decide, with that your baby, and that's something that is not talked about. And I wish I would have known just to leave everything like in the toilet, until I was completely done and then be able to go through. Because I lived in so much regret, feeling like I just flushed my baby and that was it. And I don't have anything else to show for my baby in that moment.
Yeah, I had no idea
Yeah,
that I didn't even think to look it up, like what to expect.
I know.
I just thought it
Yeah.
was gonna be like I thought it was gonna be like postpartum where there's like a bunch of clots, and I just
Yes.
assumed it was like the first clot, and that was it. And so I have a ton of regret from that too because I didn't know.
I know.
And so yeah, I share it even though it's kind of like graphic, but
It
like
is.
if
Yeah.
you're gonna
I
go
can.
through that, like you should know what to expect so that you can make decisions that feel best for you without being like, oh my God, if I had known, I would have done something different.
Yeah.
But yeah.
Yeah, it's the same with ultrasound pictures. I wish like when they were checking my belly, I would have got those images even after, passing, just because then I would have had something, to like remember that our baby by. And it's like, those moments, we can't educate to advocate enough, right? For other, parents as they're going through or having their own experiences with this. And they can create their own way. They can hear others, they can hear your experience and that might resonate and they take away something from it, which is fantastic, any way that we can help them. um so yeah, and what's interesting is I doing full panels of blood work and things like that after loss, looking at your blood work in a way of survival versus thriving for pregnancy is a whole different thing too. And understanding that. So with your thyroid and everything, is that what really led you then when you did the paleo diet, all of those things to really get into the fitness side of things, the healthy eating, all of those different things that you put on Instagram and share with everyone because I find it very helpful.
So we were doing all the fitness stuff like well before my pregnancy losses. It definitely helped me be more aware of like the nutrition aspect of things. But yeah, my thyroid antibody levels were pretty elevated. And so every subsequent pregnancy, I did a lot of like conception or preconception work with my providers where we did blood work to kind of check on what my thyroid levels were. And we kind of adjusted my medication based on like what our goals were. And my goal was to have a successful pregnancy. And so usually as I got closer to my pregnancies, my medication doses would increase a little bit to help kind of regulate my thyroid a little bit more. And we were definitely monitoring like a bunch of different of my nutrient levels, like in that preconception time frame. Because I wanted to kind of set myself up as best I could, knowing that this nutritional thing was potentially it was a big impact on my prior pregnancies. And so that was something that I was never quite as aware of. The fitness stuff definitely comes much easier to me. Being able to move your body and like be in a healthy position, have good endurance and stamina going into pregnancy. My first trimester was always pretty rough. So
Yes.
I don't do a whole lot of exercising for about 8 weeks in that first trimester. And so for me, like preconception, being in good physical condition going into pregnancy, knowing that I'm going to take like 2 months off, I found to be super helpful going into subsequent pregnancies. Because other things that can really impact your kind of mental state during pregnancies is how comfortable you are. And if you are out of shape, it's potentially going to increase the likelihood of like pelvic pain or a lot of other discomforts that can be kind of debilitating. And if you're already struggling mentally, not feeling good physically, it only makes that worse. And so that was something else that I was really focusing on with my preconception work. My pregnancy work was focusing on movements that improve like my pelvic stability, improve core strength, and kind of keep my like stamina endurance up so that I felt good in my body relative. Like there's obviously going to be some discomfort with pregnancy, but if I can keep myself from being in pain, it really helped me navigate the pregnancy much better. Because again, if I was in pain, it was gonna really impact my mental state more so than it already was by navigating a pregnancy after loss. But something with movement, just to kind of like expand on it, is there can be a lot of fear with exercise after a loss because it's like, well, what if it was that thing that I did? Like you may have even had somebody say it was probably because you were working out. Like you probably caused it, which is like not helpful at all. Like that's the worst thing that you could tell somebody. Like, oh my God. First of all, there is a lot of research that supports exercising, even vigorous exercise, jumping, running, lifting heavy does not increase the likelihood of a miscarriage. If anything, exercise decreases the risk of it because you're healthier. The majority of pregnancy losses or miscarriages are due to chromosomal abnormality. So there's just the way the baby was developing, something was just off. And it sucks. Like it sucks that it's like this uncontrollable thing. Because if anything, I would love there to be some like controllable reason of like something that I can just do to guarantee it'll be fine. And so it sucks that it's just like something weird just happened. Like, all right, well, what if something weird happens again? So exercise does not cause miscarriage. It does not increase the likelihood of it to include vigorous exercise, heavy lifting. And this is like supported by like peer-reviewed studies, like research supports this. Like, so if you were exercising in your first trimester, it didn't cause your pregnancy loss. If you were exercising in your first trimester, it's not going to cause a loss for you. And so I just want to take that stigma away from movement because there can be a lot of fear when it comes to navigating a pregnancy after loss with exercise. Because it's like, well, I don't want to do anything to cause another miscarriage. Exercise is not going to cause that for you. There's even some newer research now that supports that it's not beneficial to not exercise even if you have like preterm labor kind of complications happening, like a short cervix, that not exercising can increase complications for you. So if you want to move your body after you have a pregnancy loss and as you're navigating a pregnancy after loss, it's okay. And it'll probably make you feel a lot better. I have found repeatedly with my own clients, both in person and online, and for myself personally, that if they continue to move their body and to strength train and to go for walks and to do cardio activities, they felt so much better in their bodies. And like I kind of said, like when you're in pain, it sucks. Like you are mentally unwell. So now you're navigating this anxiety about pregnancy after loss, and you have like debilitating pelvic pain. Like that is just a terrible place to be. And so we have found a lot with our clients, as long as they continue like their exercising in the first trimester, if you can't, it's okay. But if you can get back to it in the second and third trimester, you will feel so much better. Our clients that like miss a few workouts, their pelvic pain starts to kind of creep back up. And they're like, as soon as I do my workouts, I feel better. So I would highly recommend exercising throughout your pregnancy in whatever way is fun for you. So it shouldn't be like a chore. If you like lifting weights, lift weights. If you like going for walks or doing cardio activity, like do that. The only things that I would say, like in regards to like danger exercise, if there's like a really big fall risk, then that would obviously not be super safe. And then environmental stuff. If it's a sauna, don't exercise in a sauna. Don't go to a sauna and do jumping jacks. Like we do want to be aware of like our environment. So is it really hot and humid? Like, is there opportunities for you to cool yourself off? Like, are you drinking cold water during your workouts? How do you physically feel during the workouts? Is going to be more important than like what specific movements that you do. There's really no inherently dangerous exercises other than the ones that have a really big fall risk.
Yeah.
Some folks like to run during their pregnancy. Some folks find it really uncomfortable. Some folks like to do stationary bike. I would say like a bike that like moves. That's probably has a higher fall risk, like horseback riding, a little bit higher fall risk. Skydiving, maybe don't do that. But other than that, there's really not like an unsafe exercise. Unless you don't like it, then don't do it. So you can feel pretty confident that if you enjoy a movement and it feels good for you in your body, it's probably okay to do. I mean, you can do more vigorous exercise, you can do lower intensity exercise. The goal is like a moderate intensity for 150 minutes per week. So that's a pretty good volume of like you're working pretty hard during it. We have tons of online fitness programs if it's easier to just follow something, both like a video based and a self-paced like app workout. But yeah, exercising is really good for you. It can really help with your mental health. And more importantly, it can help you feel really comfortable during your pregnancies because being in pain mentally sucks, physically sucks too. And it can make navigating a pregnancy just so much harder if you are in a lot of pain. In addition, exercising during pregnancy can help kind of prepare your body for birth as well, which that I think that's the goal of that we all have is to birth a baby, like a live baby at the end.
Yes.
And so exercising can help to support like your birth, whether you have a vaginal or a cesarean birth as well. So.
Yeah. And, thank you, Gina, because that was going to be my next question was, talking through that, because this is something that we discuss in support group a lot. And I was guilty of this too. So my first pregnancy after our losses, I stopped running. So I was so nervous, and I'm a runner, and I always have been, strength training, those kind of things. And I dead stopped. I just could not keep going because I was like, oh, I'm going to do something or something's going to happen. And instead of doing that, and my labor was so much worse, I felt like. And you're right, that pelvic pain, especially in that third trimester, was a lot different than, pregnancies before and things like that. So it was a different experience. And we talk about this all the time. People talk about it. They stop. They're scared. And I think talking through that is so important to understand the benefits of it, because more times than not, if you go into your doctor and you say your fears and you address one of these, it'll just say, okay, well then don't do it, but instead like encouraging that and hearing those words can be helpful.
It's also okay to do less. So if mentally it just feels like too much, like you just have a lot of fear.
Yeah.
You don't have to do all of it. Like you can do less too. I would say still do something because it's gonna help you feel better during your pregnancy. It's gonna help to make your labors a little bit easier.
Yeah.
But if like doing your normal workout routine just mentally doesn't feel there for you, it's okay to do less. Like I do want to give people that permission as well. Because sometimes you just need to like ease off from it to like feel like in control in some aspect. And if like decreasing your workouts helps you to feel more in control and to help you feel safe, then that's okay too. But I just want to like reinforce that exercise is safe during pregnancy. Like it is beneficial to do during pregnancy, and exercising did not cause a miscarriage, and it will not cause one for you. And so if you do want to exercise, you can feel confident in knowing that it is safe for you. But if mentally it's just too much, it's okay. Like it's okay also. Like you don't like that's probably not a good marketing thing for me, but like it's okay to like take a step back if that mentally feels better for you too.
Yeah. And it was really hard too after, after giving birth and to catch up almost again with my body, postpartum wise, and a lot harder to get started, to get active again too. And you're right. It's so good for your mental health. But it is also meeting where you're at, in those times and what makes the most sense. I can beat myself up all day about it, but in the moment it felt right to stop. Right. And that's okay. Like you said. So I
Yeah.
appreciate that so much, Gina. Thank you. Thank you. Well, if there's anything that you can leave our listeners with that you would love some advice, guidance, whatever you would like to give to everyone.
So it sounds like there's an amazing community that you can be a part of with Chasing the Rainbows. And one of the things that I found really, really helpful for me as I was navigating losses and as I was navigating pregnancy after loss was being a part of something where other people had experienced the same thing as me. Because I typically found that folks who had never had a loss before sometimes just don't say the right thing, like in an attempt to be like kind and to be compassionate. And this is like something that I have to like talk to my sister about sometimes because she'll say stuff like from a good place, but it just comes off weird because she's never had a loss. And I'm like,
Yeah.
I got it. Like, your heart is with me. Like, you're
Yes.
giving me all your love. I don't care. And so I find that being a part of something, if it's just like another friend that's had a loss or something where other women have been in a similar situation from you, I find like is super beneficial to helping you navigate something because people don't talk about it. Like,
Yeah.
it's this like secret society that so many of us are a part of, and there's a
Yes.
lot of shame and stigma with it, and it's hard to be a part of this community, but it's really, really helpful to have other people to talk to kind of normalize what's going on, to just say and vent and see, like, it's so important to have other people that you can connect with. So I'm glad that there's this community. I'm glad that the listeners are probably a part of the community in some aspect. If you just need someone to talk to, you can always just like email or DM me too. I'm always happy to talk to other lost moms about whatever, like, because it is hard to be a part of this community because nobody really talks about what it's like to be a part of it, and it can feel really isolating and lonely.
Yes.
You didn't do anything wrong. You didn't cause your loss. You don't deserve to be here by any means, but you don't have to be alone in this experience, and you don't have to be ashamed or embarrassed by it. Yeah.
Oh, Gina.
Oh, yeah.
Just thank you. Thank you so much for what you just said, for being here, for sharing your inspiration, your insight, and this, perspective that is so overlooked and bringing it into this conversation. I can't say that enough to you.
Thank you for having me. I always love sharing my story because I know it's going to help somebody feel less alone in it, and it's what I would have wanted. So thank you for having me.
Yes. Thank you, Gina. Thank you. Today's episode is a powerful reminder that healing after loss isn't just emotional, it's physical too. Our bodies carry so much of what we've been through, and learning how to support, strengthen, and reconnect with them is a part of the journey forward. To anyone listening who feels disconnected from their body after loss or unsure how to move forward after pregnancy loss, you are not alone in that feeling, and your body is not something that has failed you. It's something that deserves care, patience, and compassion. There is no timeline for healing. There is no right way, but there is support. And there is always a beginning to rebuild trust one step at a time. At Chasing the Rainbows, we're here to walk alongside you with free daily support, resources, and a community, because every loss matters and no one should ever have to navigate this alone. If this episode resonated with you, share it with someone who may need to hear it. And if you are looking for support, want to get involved, or honor your baby, you can visit chasingtherainbows.org. Thank you for being here, for listening, and for continuing to have these important conversations with us. Until next time, this is Cried Out Loud.